Hi, I'm Annie with Forest of Arden Healing Arts. In this video, I'm going to show you how to do self-care for your lungs and pleura using fascial release and visceral manipulation techniques with self-massage tools from Tune Up Fitness, the Plus Balls, and the Coregeous Ball. The lungs are two spongy, cone-shaped organs of respiration contained within the pleural cavity of the thorax. The base of each lung rests on the diaphragm, the large muscle here that separates the thoracic from the abdominal cavity. The top of each lung is up here in the curve of the first rib. The lungs are organized as lobes. The right lung has 3 lobes and the left has 2 because it has an indentation for the heart to fill. The lungs go from the first rib to the bottom of the 7th rib. Air travels from the nose and mouth through the back of the throat into the trachea, which feeds into 2 primary bronchi, one on each side, which then split into smaller passages called bronchioles. These passages end in tiny cul-de-sacs called alveoli, where the exchange of gases, oxygen for carbon dioxide, occurs. This is the primary function of respiration. Like all other structures in the body, the lungs are surrounded by fascia. This fascia is called the pleura. The pleura is a double-layered serous membrane that wraps around the lungs. The visceral pleura adheres to the lungs and dips into its fissures. The parietal pleura attaches to the chest walls and the diaphragm down to the 12th rib. During respiration, the lungs move within these pleural cavities. For a full inspiration, they can fill up the entire pleural cavity. The lobes of the lungs and pleura were designed to slide over each other. The pleura need to be flexible and lubricated enough to allow for unrestricted movement of the lungs. Pleural restrictions are common. The pleura can be injured by any pleural pulmonary disorder, including infection and inflammation or trauma to the thorax. Problems with the ribs or surrounding muscles and connective tissue, such as tension, rigidity, and hardening, can be transferred into the lungs via the pleural attachments to the rib cage. In this session, we are going to be stretching the connective tissue around the lungs, including the superficial fascia under the skin of the front, back, and sides, the muscles of the back, sides, and chest, the rib cage, including the intercostal muscles between the ribs, the muscles on the inside of the rib cage, and the wall of the thoracic cavity, and finally, the pleura and the lungs themselves. Contraindications. If you have any spinal, respiratory, lung, or heart conditions, or any device installed under the skin, such as a pacemaker, consult your physician before doing these exercises. Don't do this if you have osteoporosis in your rib cage or if you have a broken rib.
For the lung mobilization, we're going to use different tools. The main tool we're going to use is the Coregeous ball, and you can use it fully or almost completely inflated. However, if you have any sore ribs or history of any kind of break or any issues in your lungs or rib cage, you can also use a less inflated ball. The color doesn't really make a difference. I'm just showing you the different inflations. We're also going to open up the back fascia with some of the rubber balls. So you can either use the small YTUs or you can use the medium plus size balls. There are other props and bolsters that you're going to use, which I will explain as we go along. So the first step you want to do is simply lie back on the mat and rest your back. So allow gravity to hold your back. Allow your lower back to soften. You can bend your knees if that's more comfortable for you. And allow your rib cage and spine to relax. If you want to increase the stretch a little bit, you can bring your knees in towards your chest and rock back and forth. And elongate the low back. And you can hang out here for a couple of minutes. Then the first move you want to do is you want to stretch the fascia of the erector spinae, which is the two long muscles that run the entire length of your spine down the back. So what I'm going to do is I'm going to start with the balls on either side of my spine, right next to the spine. Plant my feet on the floor, bring them in as close to my hips as possible. Lift my hips up off the floor, and you can see I'm gently lifting my head, simply to take the weight off. So there should be quite a bit of weight on the balls, and I'm going to slowly roll down the back. And as I roll, I may feel some spinal adjustments, some cracks. And that's great. Now for me, I have access to rolling back down. If that doesn't work for you, then you can just replace the balls back at the top of the shoulders. So again, I'm pushing with my feet firmly on the floor. This is why you need to do this on a yoga mat, so the balls don't slip out from underneath you and so that your feet have a place to grip. All right, so then once I get to the curve of my back, I'm gonna reset here so that I don't get out of the frame, whereas you can just take it. And then what I'm gonna do is place my forearms on the floor, lift my hips, and slowly stretch down the lumbar spine. You can take it all the way down into the sacrum. That's the triangular bone at the base of your spine. Just don't roll on your coccyx. You can roll either side of your coccyx, but don't roll on the coccyx itself. And then again, I have access to rolling back up. If that doesn't work for you, then just reset. Now the second move you're going to do, you're going to use the core ball. And with all of these moves, I'm showing you with my shirt on. However, at home, do it with your shirt off. You absolutely need the skin, the ball to skin contact in order for this to do really good work for your fascia. The reason that we want to do this core ball work directly on the skin is that the core ball is sticky, and so it's going to pull your skin. And when you pull your skin is directly connected to the superficial fascia. So you pull the skin, you're accessing the superficial fascia and you're creating a pull in the superficial fascia. The superficial fascia is connected to the layers just below that. So in this case, it's going to be connected to the fascia around your rib cage. And so it's going to stretch the fascia around your rib cage. As you stretch through the rib cage, you're going to be stretching the ligaments that hold the pleural sac in place, and you're also going to be, by stretching the pleura, you're going to be stretching the fascia of the lungs. So then you're going to lie back on the ball, and again you're going to lift your hips so that you're pressing your weight, the weight of your upper body, into the ball. Now I'm directly in the center on my spine, and what I'm going to do is I'm going to plant my hips on the floor and go side to side. So we're trying to stretch the fascia, which will stretch out the fascia around your rib cage, which will affect the tissues on the inside of the rib cage, the pleura, and the lungs. So you can do this in 2 or 3 different positions. So an accommodation for those of you who can't maintain the lift in the pelvis for that work is you can use a yoga bolster. So you're going to slide up close to the yoga bolster, and then roll your pelvis onto the bolster. Then roll to the other side so you can place the ball in your upper back and then roll back on. And there, you've got the tilt in the body weight to get that weight pressing on that core ball. The next move with the core ball is you're going to roll it up and down the length of your thoracic spine. So from here to here. So start at the top here and lifting your pelvis just slightly, pushing back on your feet. You're going to roll up and down. Like I said, if the roll down isn't accessible to you, you can simply roll up and then replace. On the third one, you want to search for areas in your spine that are tighter than others. And how is that going to feel? It's going to feel achy, less mobile, more resistant, like a speed bump, that the ball and your back, they don't want to slide over each other. So, for instance, I feel something up in here between my shoulder blades, but high up. And then right here, in between, kind of right at this area in the back, I feel almost an ache. It feels bony and hard. So now the technique is going to be a pin and spin and breathe. So what you're going to do is you're going to pin the ball to the floor. You're going to spin. Again, this is without your shirt on, so your skin is going to wind up pretty tightly. And then once you get max bunching up of the fascia, you're going to breathe deeply into that area. You can breathe in 3 times or tighten that wind up, and then spin the other direction. So I'm kind of walking around, spidering around my legs. Okay, so that feels even tighter for me on this side. So I'm going to, I've spun, so I've bunched up my fascia, including my skin. If I didn't have my shirt on, it's tightening the area a little bit, or it's compressing this area. Breathe into this. Take about 3 deep breaths. Now, roll out of that and see what you feel in your spine. I personally feel a loosening in this area, but I feel that loosening has penetrated kind of into the center of my rib cage. All right, for this next one, come back up onto the core ball. And what you're going to do is you're going to go side to side, but you're going to take it farther so that you round the corner around the edge of your rib cage here. A lot of people get corners where it's almost like a squared out corner of the rib cage. And so you're going to try to catch that corner and stretch along those corners here. So it may look something like, so there I'm on the corner. I'm going to catch it and stretch it out. On the corner, catch it. Really try to catch that corner. Breathe into it. Stretch it out. And you can do 2 or 3 locations along your rib cage, depending on how long your rib cage is. So find that corner and stretch it out to the side. Find that corner. Stretch it out to the side. Remember I showed you how low the pleura go. So stretching out the rib cage, the lower part of the rib cage is going to stretch the pleura, giving more space for your lungs to descend down into with deep inhalation. Okay, so this next move, you're going to lie on your side with the Coregeous ball directly in your armpit. So your arm is stretched out overhead. Give yourself a pillow here. And if you need to, straighten your bottom leg and bend your top leg over. Also, if you need a bolster, here, just put your knee over the bolster like that. There you go. So here, you want to breathe in deeply and allow your rib cage to relax and stretch over that ball. We tend to forget that a lot of our lung real estate is actually in the armpit. So breathe into this fascia and let it soften. Good, and one more deep inhalation. And with the exhalation, just let everything go. Now, you're going to roll the ball down your side about 1 inch or 2. Excellent. Same idea here, head on the pillow, arm outstretched, and see if you can roll just a little bit more onto the side. Perfect. That's it. And breathe, softening into this area. Good. And then if you have a long torso, you're going to place the ball on a 3rd location, just about 1 inch or 2 lower. Excellent. You can bring that pillow with you if you want to. And again, on your side, that's right, yeah. And see if you can just completely let everything soften onto that ball. Now, the next move, you're going to go back to the 1st location with the ball in your armpit. And now what you're going to do is make sure you're really on that side. Yeah, that's it. Perfect. And now what you're going to do is that boat rocking. So you're going to go side to side, trying to catch the fascia on the side of your rib cage. So it doesn't have to be a big movement yet. Just go side to side. Really come onto the side here. Yeah. So you want to make sure that your body is fully on the side like this. Yes, you're really trying to open up the seam of your shirt like that. And then once you're here, you can roll side to side. Does that feel better? Yeah. Like a gentle rocking motion of a boat. Put your head, there you go. And then come down to the 2nd location, just about 1 inch lower. Bring the pillow with you. Good. Yeah. And breathe deeply into your rib cage so that everything can just soften on that ball. Let go of your belly. Yeah, just let go. That's it. Good. And then go to the 3rd location. Yeah. So allow that ball to take your body weight. It can take a lot of weight, it can take a lot of pressure. So for the next moves, we're going to be face down on the core ball. If you have tight ankles and tops of feet, you may need a blanket on the mat, or you may need a little pillow. You may need to stack this up so that you can be face down. So what you're going to do is you're going to place the core ball as high up so that you catch this fascia as possible without choking yourself. And for women, you're going to need to move your breast tissue to the side. And I like to keep my pillow here so I can completely let go of my neck muscles. And once you're here, breathe deeply. See if you can let your shoulders completely let go. Let your lower back completely let go. And take in some deep breaths. You're going to feel more pressure on the ball here. And that is stretching the tension in your sternum, in the manubrium, in the joints where the clavicles connect to the sternum, which is the manubrium. And then you're going to place it slightly lower down. And again, breathe in. Many of us have an indentation in the rib cage in here for many reasons: bad posture, tension, bra strap tension, and just breathe into this opportunity to soften this fascia. Let go of that fascial strap. Be careful that you don't roll the ball onto your xiphoid process. Next, come back up to the first position without choking yourself. And then you're going to go side to side. So you're going to stretch out the front of your chest fascia. Stretch side to side. You may even stretch out some of that fascia below your clavicles, which is excellent for getting deep breaths in. Then go lower down with the ball, and again. You may find you don't need the pillow for this, or maybe just working with your hands on your head on your hands works. And side, to side. Now, for women, your breast tissue may get in the way. See if you can slide your breast to the side of the ball. And if it's comfortable for you, let the ball stretch into your breast tissue. You can use the breast tissue as a lever to stretch out your rib cage. That fascia also needs to be stretched. So you can see I'm going side to side on my sternum, the front of my chest. Lean your head on your arms if you want to. For some people, you may feel a little bit more pressure having your rib cage face down on the ball, and just notice that extra pressure. If it feels a little anxiety inducing, come off of it and maybe deflate your ball a little bit until you can handle a fully inflated ball.
You want to be able to completely relax and let go of the musculature around your rib cage and let it just drape on that ball like this. Excellent. Now, roll back to the first position where we had it tucked up really high up there on the joint where the clavicles meet the sternum, called the manubrium. And then what you're going to do is relax your shoulders down, but you're going to shear your body side to side. So it's not going to be as much of a rotation. See if you can let your shoulders relax. Yes. So shearing your body side to side on that ball. Exactly. And you want to find the edge of the fascia, hold it and stretch that edge of your fascia. Exactly, and breathe into it. Now to end it all off, you want to lie back on your back, flat on the floor, or as comfortable a position for you as possible on the floor. And allow your spine, and where your spine connects to your rib cage, to rest on the floor. And notice if your rib cage and lungs interact differently in this position. See if you can fully let go of all that tissue we just mobilized. Also letting go of your arms. If it's comfortable for you to bring your legs down, do that. There's a slackening in the belly which softens the diaphragm when you bend your knees. So taking some deep breaths here. And just connect to that tissue change that we just did with the ball.